Okay, so angina is chest pain. It's narrowing or constriction of the smooth muscle in the coronary arteries where the peripheral vascular system reduces the amount of blood flow to the heart. So when blood does not get to the heart, there's not enough oxygen for the demand, and people have chest pain. The universal vasodilator nitrates will help with that. They directly cause vascular smooth muscle to relax in the arterial and venous circulation, so those vessels open up and allow more oxygen, more blood flow into the heart, and thus reduce chest pain. All right, so we have acute and chronic angina. And the goal is to reduce the workload of the heart. Adverse effects would include flushing, postural hypotension, tachycardia, confusion, dizziness, fainting, headache, lightheadedness, vertigo, weakness, drug rash, local pruritus, skin lesions, eye and mouth edema, local burning in the mouth, nausea and vomiting. Okay, so these nitrates cause vasodilation, systemic vasodilation. And so remember when we went back to our migraine lecture, what causes migraine headaches? Vasodilation. Vasodilation causes migraine headaches. Vasodilation of that cerebral artery causes a headache. So if you're causing systemic vasodilation, you're going to end up with a headache. Okay, that is one of the hallmark signs of nitrates is you get a headache, especially with those acute uses. So that headache, we don't use opiates for that headache. We use NSAIDs, aspirin, or even acetaminophen for the treatment of those headaches. Ding, ding. There are several drug interactions that increase the effects of the atropine-like drugs and tricyclic antidepressants. Should not be taken with prazosin. So nitrates are readily absorbed under the tongue, through the skin, and orally. Nitroglycerin is a nitrate. It has a very short half-life of only 1 to 4 minutes. Now this, think about it like dynamite, TNT. We need to keep it in a cold, dark environment. That's why when you see the little bottles of nitroglycerin, they're in a little tiny amber bottle, and we want to keep that away from a person's body. You know, it's not a place to keep it in your front pocket because we don't want it to get warm. Contraindicated in patients with severe anemia, closed-angle glaucoma, traumatic head injury, because the nitrates can increase the intracranial pressure. We don't want to use it with drugs like sildenafil, Viagra, because what are those doing? Those are causing vasodilation. You know, you add a little more vasodilator on top of it, and you have profound vasodilation. And it can cause life-threatening hypotension. Again, protect from light, and there's a bunch of ways we can provide these medications. There's sublingual tablets, translingual spray, oral, transdermal, topical, intravenously. If it's given intravenously, there's a special glass bottle that needs to be used. So what I'm saying is go back to your ATI book and read all about nitro, because I'm not going through all the ins and outs about administration of nitroglycerin. But you need to know that. You need to know how transdermal is different than sublingual and IV and all the little patient teaching and ins and outs of that. All right, so let's talk about very briefly, if it is absorbed transdermally and you touch a patient or you touch the cream that is going, the nitro cream, what's going to happen to you? You're going to get some vasodilation, which is going to result in what? A headache. Okay? So always wear gloves. All right, so we have short-acting nitrates like nitroglycerin, and we have long-acting nitrates like isosorbide dinitrate. All right, so if somebody has chronic angina, they're the ones that are going to have the paste or the patch or the oral pill, right? That's how we treat chronic angina. And so if somebody has acute angina on top of that chronic angina, do you think I rip the patch off and give them a sublingual tablet? No. That patch needs to stay there all the time. Well, you know, change as directed. But we don't take it off when we are giving a nitro sublingual, because then we'd be treating the chronic angina on top of the acute angina. Okay? Ding, ding. With the long-acting nitrates, tolerance is developed very quickly but dissolves rapidly. So, again, go back into your ATI books and read all about the different ways to give nitroglycerin. But I want to talk about an acute anginal attack using sublingual tablets or the translingual spray. So, patient starts complaining of chest pain. They stop activity, sit or lie down. Immediately put one sublingual tablet under the tongue and let it dissolve. Rest for 5 minutes. If the first tablet does not relieve the pain, call 911 and then the second tablet. Take the second tablet. After another 5 minutes, take the third tablet if pain still persists. Do not take more than 3 sublingual tablets. If using nitroglycerin translingual spray, 1 spray substitutes for 1 sublingual tablet when treating an anginal attack. Do not stop taking the long-acting nitroglycerins abruptly. Do not crush or chew oral nitroglycerin or isosorbide tablets. So that tells you exactly what you need to do, instruct patients. Remember, we call 911, we give the first tablet. If that chest pain continues, then we call 911 and then give the second tablet. We never give more than 3 tablets. They're all given 5 minutes apart. All right. We also use beta-adrenergic blockers to treat angina. This would be atenolol, metoprolol, Nadol. These patients don't develop a tolerance. And it's ideal for those patients who have both hypertension and angina because it's really a twofer. Also reduces the incidence of myocardial infarction. It's a drug of choice for prophylaxis stable angina. We use calcium channel blockers like amlodipine, ditalazam. They dilate the coronary arteries and arterioles in relief of anginal pain. They also can treat cardiac dysrhythmias and hypertension. Remember, calcium is an electrolyte that helps move electrical impulses through cardiac tissue. Calcium channel blockers are drugs that help slow down the flow of calcium ions across the cell membrane, which reduce the amount of calcium available to move electrical impulses. There are many actions of these drugs. There's an anti-anginal agent, ranolazine, which lowers cardiac oxygen demand and thereby improves exercise tolerance and decreased pain. This can increase the risk of torsades, so we want to monitor with an EKG. So the treatment of angina, nitrates, beta blockers, and calcium channel blockers in BC.